I'm Philippe Gevaert. I'm the outgoing ENT section chair, and I've been working in the past 2 years on all the activities of the ENT section. It's very important to have an ENT section because we represent a group, the ENTs, within the IACI, and we try to learn allergologists how to look in the nose, how to do the things in the nose, how to interpret the diseases that are in the nose, like allergic rhinitis, chronic sinusitis, and nasal polyposis. But also we'd like to learn the ENT society, what is immunotherapy, what are biologicals, and how to use them. And I think this is one of the main objectives of the ENT section. Recently we had the first RHINA meeting in Eastbourne, and this meeting was exactly meant to combine or to learn everything about biologics on one hand and immunotherapy on the other hand in the field of rhinology. And we had a very successful meeting. It was sold out and there was a lot of interaction between the ENT section on one hand and the interest groups on immunotherapy and biologicals on the other hand. And I think this is a really great formula. The next RHINA meeting will be in 2021, and I'm really looking forward for this new meeting. What is important in the field of rhinology is that there is at this point many interest in diseases not only like allergic rhinitis, where we can treat with immunotherapy, but also now in the field of chronic sinusitis, especially with nasal polyps, where we can apply biologics. And the main question in all the diseases we treat is whom to treat with these medications. I will start with allergic rhinitis and with immunotherapy. If you have immunotherapy, it's really important to select the right patient for the right treatment. It's precision medicine. It is really crucial to take a good product for the right patient and to tailor it on the patient itself. With the new tools we have, not only with taking blood, measuring specific IgEs, you can do many things, but also by good history taking of the patient, observation of the patient. And if you combine all these skills that doctors have, you can select the right patient. So to my opinion, precision medicine is more than just measuring some components in the serum. It's about combining all the things. It's about combining the needs of the patient, the desires of the patient, whether the patient will be compliant, how he reacts, what is the environment, to combine with some clinical findings and some laboratory findings. And that's exactly what precision medicine is. To my opinion, the future will change a lot. Because now we as allergologists, as ENTs, we combine this information by ourselves. And the computer only shows us some results. But in the future, computers will connect all the big data from one patient. So they will take the files of the GP, they will take what is on the smartwatch, they will take what is on the smartphone, they will capture the environment of the patient, they will look into clinical data, they will look into laboratory data, and they will combine it. And big data and artificial intelligence will probably do a better selection in the future than what we can do now. I'm not so certain whether this will be very fast. It could be that the computer still needs like 10 or maybe more years to compete with our brain. So I think the future still looks bright for doctors. We will not be immediately replaced by computers, but we have to be aware that they will be of big help in precision medicine soon. Another step is selection of patients for biologicals. At this moment, there is a big interest of industry in biologicals for chronic sinusitis with nasal polyps. And we really encourage this because nasal polyps is a really bothersome disease. Nasal polyps is a disease where polyps grow in the nose. You do surgery and they keep on returning. This disease is associated with, quite often with asthma, intrinsic asthma, severe late onset asthma, and is quite often lifelong. So we need good treatment strategies. You can do surgery, but most of these patients need several surgeries, so we need better solutions. One of these good solutions coming up now is the use of biologicals. At this stage, the price of biologicals is considerable. So we really have to choose the right patient with the right biological, and also taking into account the cost. And I think this is one of the major things we have to do, is have the right patient and the cost. Convince healthcare payers that maybe they should take the right profile of a patient and then have this patient treated with the biologicals. We call this endotyping and phenotyping. And that's exactly what precision medicine is. To predict which patient will have like 10 surgeries if we don't treat him with a biological. We all do understand that the right patient selection in here is very important. And also there we look forward for the era of big data combining all these findings and artificial intelligence. I'm an ENT surgeon, and maybe you ask yourself what I'm doing in an allergy society. Well, I think it's very important for ENT surgeons to be aware about allergy, about immunology, about the understanding of the mechanisms behind the disease we treat. We are not only surgeons, we also think about the mechanisms. And by doing that, we can choose better treatments, better options, immunotherapy, biologicals, but also simpler options to have a better treatment for the patients. Here, the IACI is exactly the place where we learn to think about mechanisms of these diseases and about the treatment of the future.